My name is Jay McFarland, and today I'm very excited to introduce you to Dr. Victoria Mondloch, who has been meritoriously named a patient-preferred physician. You're going to love our conversation, and you're going to love her focus on overall wellness. So often we see people being treated by different doctors for different illnesses. She has an approach that deals with the entire wellness, and perhaps you wouldn't have to go to different doctors to treat various illnesses. Well, doctor, it's such a pleasure to talk to you today. Thank you so much for taking some time to join us. I always like to start out by asking if what you're doing now is what you wanted to be when you grew up. Did you say doctor, or did you have other plans from early on?
Well, that's an interesting question, and thank you for the invitation to be on. When I was in high school, I was the typical nerd, although I was also in sports, and I was also in a musical. I was in band and marching band, and did pom-poms, and was on the gymnastics squad, and just kind of did a little bit of everything. But women just didn't go into medicine to be doctors. Women went into medicine to be nurses. And so that wasn't what I thought of myself as. And I actually thought of myself as doing interpretation for foreign languages for the United Nations. That's really where I thought my life was going to take me, was more into the world of politics and political and world influence. So I studied German and French in high school, and thought that would be the direction I would go. And I was co-valedictorian of my class. And so when I was preparing my speech for graduation, one of the teachers was looking over my shoulder, and and I kind of brushed him aside, like, what you'll hear this at graduation, go away. And he goes, well, I want to know what you're going to say to your students, your colleagues. And I said, well, you'll hear it at graduation. And he goes, well, what do you want to be when you grow up? And I told him I wanted to be an interpreter for the UN. And he started laughing. And I was so hurt by that. I said, you never had me in class. I said, you have no right to laugh at my dream. This is what I want to do with my life. And I said, and you don't know me, you can't judge me. So when I got home that night, of course, parents asked me, well, how was your day and whatever. So I have 4 brothers. I'm the only girl. And my dad sat me down and he said, well, you're upset. And I said, well, let me tell you about this conversation that I had. So when I told it to him, he sat back in his chair and he folded his arms and he goes, so what do you think? He said, this teacher said, when you asked him, what do you think I'm going to be? He said, you're going to be a doctor someday. And I said, no, I'm not. No, I'm not. And so I said that to my dad, and he goes, why not? And I thought, well, no, women don't become doctors. Women become nurses. So this summer came, and, I did my lifeguard job. And all summer I kept thinking, well, what if? What if? So when I went to college at Marquette, I thought, okay, I'll try to fit both foreign language and science into my curriculum. Well, that didn't work. Science classes have labs that take 4 hours, and they just don't mesh with much else. So I thought, okay, I'm pretty strong in foreign language. I'll do the science classes. So the more I did science, the more I realized I really enjoyed science. And when it came to applying to medical school, not knowing a thing about how do you apply to medical school, I didn't realize the politics that were involved. And it took a while. It took the help of a professor working in research in his lab, but I made it to medical school and got into women's health, which to me was the perfect blend of surgical and medical. In other words, you could do deliveries, you could do cesarean sections, you could do hysterectomies. You were a surgeon, you were trained as a surgeon, but yet you were caring for women every year, doing their annual exams. They grew in their lives, family wise, along with me growing through my career. So I would have patients I would deliver, and they would be my patients for 20, 30 years. And that's really what ended up happening. So the really interesting thing is I got to be president of the organization that I was in. It was a group of 8 OB-GYNs. And I decided that women don't wake up in the morning asking, wow, I hope my doctor says I need surgery today when I go to see him. No woman has that thought. No guy has that thought when you go to the doctor. So I thought, well, what do women want? They want to be healthy. They want to be able to go to their job. They want to be able to take care of their kids, run with their kids, do all of the activities their kids do, and still have time to do everything with their spouse they want to do, and maybe with church groups and with school groups. And, women are involved in so many activities. So women want the opportunity to be healthy and to do all of those things. So wellness. We should focus on wellness. And when I brought that idea up to my group, they laughed at me. So it's the second time in my life that my dream was laughed at. And I thought, wait a minute, what do you guys want? Well, we want more surgeries. We want more ways to make money. And I thought, I can't work with you. I'm the president of the organization, and I can't work with you. So I quit. I literally quit my job, and I got home, obviously, early that day and walked in the door, and my husband said, well, you're home early. 3 kids, and, he's home. And I said, well, I quit my job. And he said, you what? I said, I'll figure it out, but I quit my job. So it took me about 6 months, and I had a lot of soul searching to do, but I was certain that the direction I needed to go did not include more surgery for women. It included wellness. So I embarked on the mission of women's wellness, taking care of women. They were so pleased at what I was doing with them, hormone balancing them for their health, that they would routinely say to me, well, can you do this for my husband too? Well, sure I can. Absolutely I can. So then they'd bring their spouse in, and we would do the same philosophy of balancing their health and wellness, which then led to, well, my teenage daughter is going through all the things that I went through. Can you work with her too? Well, what about my mom? Well, what about, and it just became this extended family affair that people were so pleased with how good they felt that they were bringing all of their extended family in to be seen and hormone balanced, and the rest is history.
Well, it's a great history. In fact, I'd like to focus on wellness, but I would also like to back up a little bit, because you talked about how when you first got started, women became nurses, and you overcame that barrier. I'm sure in your situation, you found a lot of women so grateful that they could see a woman doctor. I mean, my wife in particular, she wants a woman doctor, somebody who she can
Mhm.
work with, who just understands what it's like to be a woman and to get exams and all of those things. So you were kind of blazing a trail in that regard.
Well, and you're absolutely right. When most women go in to speak about issues regarding crampy periods or heavy flow or PMS, you're talking to your doctor who's never had any of those, if it's a guy. And how can a guy relate to that? I'm sorry to sound sexist there, but you're not born with the same machinery. So, yes, you can read about it. Yes, you can read papers and you can theorize and you can know the medicine. But have you ever had a cramp? And I don't think so. And not monthly, and you don't bleed with it besides. So there are some unique characteristics that go along with seeing a female doc who's also gone through all of that. And by the time I actually hit my practice, I had already had, and this is going to sound strange, but I already had some medical mishaps that I had before starting my job as a full-time OBGYN in practice. I had already died on the operating room table once and been brought back to life. So that happened within 4 months of starting my new job as a full-fledged OBGYN. I went into a medical emergency, had to deliver my second child, being induced because of that medical emergency, which progressed after she was delivered. And I actually died the second time on the operating room table. So I've been on the other end of the bed, if you will. And both times that I was that deathly sick, both surgeons dismissed my level of pain as being a hysterical female. Now, really, so the first time I was a medical student and I was told, there, dear, the diagnosis we are taking you to the operating room for fits with what your symptoms are. Well, they didn't. And I found that out after the fact. The second time around, I am a full-fledged graduated MD, and I am practicing in private practice. And I have a surgeon telling me that my pain isn't real. So there is a lot of empathy that I have with my patients when they say nobody is listening to me. I know what that feels like, and I've experienced that myself with the MD behind my name. So been there, done that, and I will not do that to my patients.
That is amazing, amazing. And I just think even beyond that, we know that men and women, we speak a different language. I mean, sometimes just normal communication is difficult, not to mention communicating how your body is feeling and what you're experiencing. So I'm sure that makes it a lot better in having a woman treat a woman.
Well, and from the emphasis that I take for wellness with men and with women is really honed from what I learned with women, which is the foundation of our health is like the four legs of a chair that you sit on. And it's based on the four hormone groups that you have and that I have. It's just that in the female male hormone department, we as women carry four sex hormones and men carry two. And so we have a little more complex sex hormone balancing we have to do. But our thyroid, the second hormone group, is the same. Our adrenal or cortisol, our third hormone group, is the same. And our blood sugar insulin, the fourth hormone group, is the same. So the tricky part comes in that first leg, whether it's female or male, but all four of these hormone groups have to be in balance with themselves and with each other. Otherwise, imagine sitting on a chair with a broken leg. What happens? You land on the floor. Right. And then you wonder, how did I get here? Oh my gosh. So you rewrite the chair and you sit back down on this chair with a broken leg, and boom, you land on the floor again. And it's like Groundhog Day all over again. But nobody's helping you figure out you've got a broken leg on your chair. What a concept.
Yeah, it is an amazing concept, and I think it flies in the face of what we see so often in medicine today. I have a great doctor right now who focuses on my wellness, and I'm very grateful for that. But in the past, before him, it was always walk in, describe a particular thing that I'm experiencing, get a prescription. I'm like, I got a prescription. It's going to solve the problem. And as you describe the legs of the chair, I feel like it's like replacing the chair with something that is not going to be sturdy and not going to hold me up, but it's going to make me feel, it's going to cover up the problem for a while. And that's kind of been my experience up until now with medicine. And I think we're programmed as patients now. Like, I think people are disappointed if they don't walk out with a prescription. It was like that was going to be the solution to my problem.
Well, and you're absolutely right. We are pre-programmed that way. Think of all the commercials that you see from 6 p.m. to 10 p.m. that talk about every ailment you may have, and we have a pill for that. And that's not what bodies were meant to be, was, detoxers of chemical pills. We were born with a body meant to balance itself. It is meant to know how to heal itself. If we give it the proper nutrition and tools, it can heal itself, but we put chemicals in instead. And we ignore the warning lights that are going on our dashboard that say, danger, danger, something's about to go wrong. And we go, oh, well, that must mean I have to go into the doctor to get a chemical prescription to cover up the biologic imbalance that's going on. Well, whoa, wait a minute. If you say that to your mechanic, he'd go, that doesn't make any sense. So why would we treat our body differently than we treat our car?
Yeah, probably because it's just the easier path and we're lazy and we want a quick solution. I'm guessing that as you talk about wellness, you spend a great deal of time educating people on their bodies and how they work, just as much as you do maybe prescribing certain things that they need to do. You are an educator, I'm assuming.
I am an educator. Thank you for making that statement. And I've written 2 books. I've also authored chapters in other books about women's health, although I've got a men's book coming. So pay, pay close attention, coming soon to a bookstore near you or Amazon near you. But it's not about educating doctors. Doctors think that they've been properly educated and that hormones are the realm of the endocrinologist. Oh, because that's a specialty area. Well, no, it's a foundational leg of our chair. So doctors have been duped as well that this is out of their purview of medical practice, and it's not. So every woman that I know of is going to have periods, is going to at least consider the fact that they would like a family someday, or if they don't, how do they safely prevent that from happening? They know if they live long enough, they're going to go through changes. And these are all very known stages of a woman's life, but yet they can be very difficult for the body to manage. Think about the fact that 100 years ago, menopause didn't exist. We didn't live that long. Our average lifespan, right, was 48 and a half years old in 1912. So menopause didn't even exist. So neither did antibiotics or safe anesthesia or the idea of doing a cardiac bypass. Those are all newer innovations, but because some of those innovations took on the medical realm of we can do surgery or write a script for that versus the natural progression of a woman going through having hormone that was so good for her up to age 48 and a half to 50. And now you hit menopause, have all of these symptoms of where'd my hormone go? And now suddenly hormone is bad for you. Well, wait a minute. Wasn't hormone really good for us before? So what changed from then to now? It's the same body, it's the same hormone. So why is hormone suddenly demonized? And if you look at the research, it's because the research they did was not good research. It didn't look at putting bioidentical hormone for a human being back into a human being. It looked at horse urine, ooh, pregnant horse pee, ooh, that just sounds horrible right there, and a synthetic progesterone. So, horse and synthetic. What is human and bioidentical about either one of those? Doesn't take a rocket scientist to know neither of them are human based or bioidentical. Yet, that's the main research that this country hangs on to say that hormone is bad for women. Yet the Europeans did all of the right research looking at human based female hormone and came to the opposite conclusions that female hormone not only increased longevity, it had minimal impact on breast cancer, in fact, decreased breast cancer, decreased heart attack risk, and decreased stroke risk with increased longevity. What's bad about any of that? Nothing. Yet, shh, we can't talk about that because that's European research. That's not American research. And that's not what we found looking at pregnant horse pee and synthetic progesterone. So we're going to stick to our guns and keep breast cancer up, keep stroke, keep heart attack up, and tell you that hormone is bad for you. What? What? It makes no sense.
No, it doesn't.
Right.
It makes me think, what are we going to discover about the human body as we are able to extend our lives and live longer? I mean, that thought about menopause didn't exist. What if we're living over 100? What else are we going to discover as we go forward? It's fascinating.
Well, it is. And the world of energy medicine is going to take us there as we learn to recharge the mitochondria in our body cell by cell, take us back to a younger age. Because if we can recharge the energy level that our mitochondria work at, we will continue to decrease the quote age of that organ system that that cell is in, and therefore our body will work metabolically more efficiently.
That's an exciting prospect for sure. I read one of the comments from one of your patients, and she was talking about how she had all these different issues, and she had to go to all these different doctors for each individual issue, and she was so excited to go and see you because you were able to treat all of those problems, and I think that says a lot about your approach.
Well, and if you think about it, and I'll take guys just because, you're a guy. If you would walk in and say to your primary, gee, I've got some acid reflux stuff going on, what do you think he would say to you? And and if that doesn't work, and if that doesn't work, he might send you to gastroenterology. We'll let them scope you, okay? So, what if I say to you, okay, well, what else do you have going on besides GERD? You would say, so maybe you're having some trouble sleeping at night. So, when you eat certain foods, you get bloated. Do you notice that you're a little cross? You're a little forgetful. You might have a little bit of um, short-term memory loss. Not a lot, but enough that you go, oh, yeah, I looked for my car keys for 5 minutes before I realized I was holding it in my hand. Those kinds of things. Um, well, those are all in multiple different areas of life, not GERD, right? Well, what if they do tie together? What if it ties to where is your testosterone level? One leg of your chair. What if it ties to where is your stress level? Cortisol. Second leg of your chair. Okay, now you've got two legs. Sorry, I'm trying to keep my my hands in the on the screen. What if it has to do with your thyroid is changing for you? In other words, realize that multiple symptoms happening at the same time doesn't mean, oh my gosh, I've got to send him to 3 or 4 different specialists in a sleep study because of insomnia. And oh my God, it's going to take us 8 months to get to the bottom of this. Well, no, no, no. The simpler approach is to stand back and go, wow, these all happened at relatively the same time. So, what might be a common underlying influence? What is your testosterone level? And can testosterone be at a quote normal level, but could it be age inappropriately low? Whoa, right, right. But unless you think of that and then take the foresight to get your total and pre testosterone levels checked, to know if you are actually in age appropriate range. And what do I mean by that? Well, this will be coming in the men's book, but there is actually a graph that shows for age and percentile where your testosterone should be, not just in the normal range, but where on this graph do you fit? And if you're, and I'll just give an example of somebody who came in at 35, and at 35, their numbers came in at 25th percentile. Well, that's not where he should be. He should be way up here. So that's too low for his age. His number is in the normal range, but it's age inappropriate. You follow me? So, right. So it's as simple as knowing this graph, okay? And women have a similar graph, and women now have their female hormones as well as their male hormones to balance. And there are conditions where stress can do this, polycystic ovary can do this, that women will have more male hormone than female. And you go, what? But unless you look, how do you know? And if symptoms are showing more male excess symptoms, like excess growth of hair, excess loss of hair here, maybe acne and oilier skin, feeling a little more assertive than maybe you should, or putting on mid abdominal weight gain, those are all excess testosterone symptoms that if women are telling you they have this, to me, it's as clear as day. Those are all excess testosterone symptoms, even though they cross multiple lines of hair and skin and weight gain and emotional, more aggressiveness. So that screams excess testosterone to somebody like me. So so you just have to know what your foundation of your health really is. And if you don't take a look at the legs of your chair first, you miss the point. You miss it.
Yeah, and you may be just lengthening out the problem. It's just fascinating discussion. Tell us a little bit more about your books. I'd love to hear a little bit more about them.
Well, as you can see behind me, the one is blossoming. That is this one right. This well here. Let me do this. Is I've written 2 books, and Blossoming is the adolescent book. This is written for the pubertal to age 20 to 25 female, and it's written as a mother daughter guide. I'll come back to that in a second, okay? The second book is, and I'm sorry, I'm really bad at this. The second It is. Oh my gosh. The second book is Full Bloom. And this is the book that is for the 35, 40 to 50 to 60 and beyond female. So this is all about perimenopause, menopause, postmenopause, and beyond. And the reason that I started with those two books first, in particular, I started with the teenage adolescent book first, is that they're the forgotten female. Now, think about it. If you see an adolescent girl and she's having a bad day and she's maybe a little more dramatic, she's a little more oh, harried, stress has gotten to her, whatever, what do most people say? Oh, you're hormonal, you're a drama queen, go to your room. Okay, so that adolescent is likely going through what I call and what I've tracked as in a female, the swings that go along with hormone being off. And when their hormone is off, what's going to happen is this kind of timing over here in your 20s and adolescent before that, this mimics what happens over here, 40s to 50s. In this territory, oh, my camera, my finger aren't. Ah, right. But you notice the up and down that happens in the 40s to 50s? That same up and down happens in the adolescent years. But nobody checks. Nobody even looks. And if you never look, you never know. So those same up and down swings are going to give an adolescent the same changes in their female hormones that their mom in their 40s is going through. Again, like mother, like daughter. So a mom has been through that. Yeah.
But again, to the teenager, we'd say, I had a similar experience with one of my daughters. She would get in these modes where she'd just start crying. She was irritable. She'd start yelling at people. We didn't have anybody who identified that it was a hormone issue, but we did have a doctor identify that she had some blood sugar issues and what she needed was protein. And as soon as she got protein, it was like this miracle cure. She would just return back to who she was. So we stopped being that parent. And I still regret that I was that parent for a while, saying, get over it. Everybody has problems, instead of trying to figure out what is the real cause of this problem. And so even when she'd play sports, we'd see maybe she'd start to cry or something. Even her coaches carried around protein for her so they could just give her some protein. She would just perk right up and just be right back to her normal self. I compare that to if you had the knowledge of the hormonal things going on in her body, how much more progress we could have made. But I think you're right. So many parents, the tendency is just, you're just like everybody else. Just, pull yourself up by your bootstraps, grow up, woman up, whatever it is. And you could be doing real damage to them psychologically when it's a physical thing that they can't control.
And they don't have the knowledge base because their doctor doesn't have that knowledge base. And the mom who's trying to help or the dad who's trying to help doesn't really understand that it's a hormonal issue or a blood sugar protein issue because nobody's ever told you that could be an issue. So you are inadvertently a part of the problem. You're not listening. Therefore, if you're not listening, you are an adversary, not an advocate. And so the mother daughter book is because the mom going through what the daughter went through, or maybe they're both going through that swing of up and down together. The mom can be an advocate with the pediatrician or family practice doc with the daughter. Think about the daughter finally gets her nerve up, has her questions, and mom takes off work and we're going to go to the doctor and get to the bottom of this, right? Well, you get there and in a typical pediatrician's office, it's well child check day every day. So it's, a 6-minute appointment, and you're weighed and you're measured and you're put in a room, and the doc comes in and goes, well, your height and weight are on the growth chart. Do you have any questions? And then suddenly you go, yeah, I want to talk about PMS and heavy periods. And it's like, and that poor pediatrician just A, wasn't ready for it, B, has no knowledge to be able to impart, and C, you just wrecked the next 3 patients and took more time than you should have just by asking that question. So his answer is going to be, oh, well, we'll send you to gynecology and we'll let them answer that question. Well, you just got dismissed. Your doctor just dismissed you. And as an adolescent, you just took up all this time and energy, screwed up your courage to ask that question. You just got swatted down. Are you really going to go to a gynecologist, your mother's doctor? Oh, good heavens. And ask that same question? Oh, no, you're not. No, you're not. Even if your mom goes with you as your advocate, you've already been embarrassed. You've been shot down. You're not going to do that again.
Yep. Yep. I totally agree with that. How can people find out about your books? How can they get?
Well, actually, I'm going to give you the website that I'm on. And the website has not only the books, they're on Amazon, but also my YouTube channel is there. And I do local and national radio shows that are archived on the same website. So the website is RHM, my group, rhm.care, CARE /VJ, my initials, Mondloch, MONDLOCHMD. So again, rhm.care /VJ Mondloch MD. And again, all of that information is archived on there, as well as an invitation for a free 30-minute consult to any comers, anybody who wants to safely ask their questions. You get 30 minutes free, no strings attached.
That is amazing. Absolutely amazing. One final question for you. I could talk about this forever. I just love your perspective. We do have a little bit of a time limit. You have been named a patient preferred physician. Can you talk about that a little bit and what that means to you?
Well, what it really means to me is that as a private physician, not affiliated with a university, with a medical school, being recognized for the educational value that I can offer to my patients. And I don't have anybody standing behind me promoting me. So it's me, myself, and I with my group that I'm their national physician trainer. But doctors aren't in the business of promoting themselves. That's just not what we do. You don't see us doing commercials on TV about our medical practice and giving T-shirts out away, at an event. You know what I mean? So it is something that most of medicine is referral only. So to not only have most of my patients be here by family referral, meaning that family is already here in the office. And so word of mouth and family referral is huge. And that level of family referral, local and yes, national radio shows, but that level of referral has meant so much to so many people to have caught the attention of a national group such as yours and now be accoladed for that is just beyond what a private doc's wildest dreams would be.
Well, it's certainly deserved. And I know that you are changing not just people's health, but I think you're changing their quality of life and their perspective, and you're giving them tools to where they can help themselves. So I just appreciate what you're doing. And I certainly appreciate your time today, just sharing some of your wisdom and your knowledge.
Well, and I thank you for the opportunity to come on and be able to do that. That means the world to me. Thank you.
Well, thank you so much for joining us, Doctor.
You're more than welcome.
Once again, I want to thank Dr. Victoria Mondloch for joining us. You can just get a real sense of her passion and excitement for what she does, and it's obvious she has helped so many people with her overall wellness approach. And once again, I want to thank you for joining us on this edition of Patient Preferred Presents.